Hi guys. Today we'll discuss about the convulsive status epilepticus, especially in pediatric case. So how to manage and what are the initial steps you have to do, especially in ER room. So once you receive the convulsive status epileptic patient in pediatric case, first of all, the condition is the seizure, the duration, if it is more than 5 minutes or once the seizure, if it lasts more than 5 minutes, then you can consider CESE, which is a convulsive status epilepticus. So the ideal management is the first you have to confirm it, and the second one you can go and you can check the ABC, airway breathing circulation, and you can check whether the patient needs oxygen supplement or not, and other vitals, and you can check the glucose. So ideally the three line of drugs management. The first thing is the first line drugs, which is nothing but the midas and lorazepam. So once you check the patient and once you confirm that this is a CAC, the first line drug is midas and the dosage is 0.5 milligram per kg, and if you choose the lorazepam, it is 0.1 milligram per kg IV or intraoral, and the ideal duration should be more than 5 minutes. The seizure should last more than 5 minutes duration, and if the seizure duration lasts for 10 to 15 minutes, then you can go for lorazepam 0.1 milligram per kg IV. Then the first thing is you have to reconfirm it, and you can go to the second line of drugs if the seizure duration persists. Coming to the second line, that is if the seizure duration lasts around 15 to 35 minutes, if the patient, if your pediatric case is persisting or recurrent seizure coming, or the particular individual seizure lasts for 15 to 35 minutes, the ideal second line of drugs is Livipil, obviously, which is 30 to 60 milligram per kg, and should be given over 5 minutes, and maximum you can give around 3 milligram, or phenytoin of 20 milligram per kg, slow IV over 20 minutes. But the thing is, once you give phenytoin, you have to check for bradycardia, because if you give it rapidly, this can cause bradycardia. That's a complication of phenytoin. So another drug is phenobarbital, which is around 20 milligram per kg. It can be given over 5 minutes duration. And the thing is, once if you are handling this kind of a case, you have to further inform the ICU department. So in case if the patient is having the sepsis, or if your particular condition is having if the patient is around a sepsis stage, you have to check for the calcium, magnesium, because that will be low in the sepsis, and you have to check for the sodium, and if you find hyponatremia, you can treat the hyponatremia, and check the temperature, and treat if in case of hypothermia. And the third line drug is that, which third line drug means if the seizure, if it is the duration of seizure, if it is around 20 to 40 minutes, then you can go for third line drugs, which is nothing but the deeper sedation and further securing the airway by intubating and under ventilator setup. And further you can go to the second line drugs once again. The ideal is the thiopental sodium, which is around 4 milligram per kg in IV, or sometimes the alternatives like ketamine, midas can be given, but there is no ideal proof that if you give this drug, this particular cure. So still under research. So these are the first line, second line, and third line drugs which you have to treat in ER and ICU for a convulsive status epileptic pediatric case. So do read about it. Thank you.